Okay, good afternoon, everyone, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. As a reminder, the Zoom is for press only, so if you are not a member of the press, please log out and watch today's live stream on the Health Department's Facebook and Twitter pages, Comcast Channel 64, or Verizon Channel 40. We're going to begin our briefing today with opening remarks from Mayor Kenny. Mayor, I think you just have to unmute yourself there, and then you can get started.
Thanks, Lauren, and good afternoon, everyone. I have to start today with some sad news. Yesterday, we recorded the 3,000th death from COVID-19 here in Philadelphia. That's more than 3,000 Philadelphians lost to this terrible virus in less than a year. Our thoughts are with the loved ones of those we've lost. Each life taken is one too many. With that in mind, I do have to recognize another member of our city employee family who succumbed to the virus. Firefighter John Evans passed away on Saturday after a tough battle with COVID-19. He served in the Philadelphia Fire Department for nearly 4 decades, and we send condolences to his family and friends, Commissioner Teal, and everyone at the fire department. Despite the grim milestone we've marked this week and the challenges experienced recently, I want to take a moment to also acknowledge that things are still moving in the right direction in Philadelphia when it comes to beating back COVID-19 and getting people vaccinated. Our new case counts continue to decrease, and weekly positivity rates are lower than in neighboring counties. Nearly 72,000 people have been fully vaccinated as of this weekend. There is still a long way to go before we're all on the other end of this, but we have reason to be hopeful. Last week, the Biden administration announced that they had purchased another 200 million vaccine doses. We're beginning to see our weekly allotments increase, and we expect the Johnson & Johnson vaccine to come online soon. This past weekend, the health department finished the second dose clinics for individuals who received a first dose of the vaccine from Philly Fighting COVID. Vaccine partners are working to reach more community members right in their neighborhoods, especially in communities of color. In the next week, the health department will open community-based mass vaccination clinics. Philadelphia is moving forward and in the right direction. At the same time, we are thinking ahead about the future vitality of our city. Our economy and the culture of Philadelphia is dependent on people going to workplaces, sitting down to eat in restaurants, shopping, coming in for meetings, and not just running up the Art Museum steps, but exploring the inside of the museum. We are thinking ahead and planning for the day when the majority of Philadelphians are vaccinated. That day in the not so distant future when residents and commuters can safely and gradually start getting back to everything we love about our city. I look forward to working with all of our partners across the city as we approach that a long-awaited day to ensure Philadelphia is ready to come back stronger than ever. Until then, we remain focused on slowing community spread of COVID-19 and getting residents vaccinated as quickly as possible. Now I turn it over to Dr. Farley.
Thank you very much, Mayor. I have better news today. Our case counts are falling. I'll update you on the epidemic and then where we are with our vaccine program. First, some numbers. Since this time yesterday, we've identified 103 new cases of the coronavirus infection in Philadelphia residents confirmed by the PCR test, for total confirmed case count since the beginning of the epidemic of 110,836. Now, since yesterday, we've reduced the number of people who counted as having probable cases by the rapid antigen test by 3 because these are people who subsequently had a positive PCR test. And for the past week that ended on February 13th, we averaged 242 cases per day. That's the PCR test and the antigen test combined. That's so far, and we expect more. And of those people tested, 3.8% of the people tested positive. Now, for comparison, the previous week that ended on February 6th, we averaged 323 cases per day, and 5.3% of the people who tested were testing positive. Now, even that 5.3% is lower because we had many previously unidentified negatives that came into our data. These numbers overall are showing a significant decrease in the past few weeks. Our case counts are falling, and they're also falling in the state of Pennsylvania and in New Jersey and the United States as a whole. It's really good to see this continued downward trend. Now, where are we with deaths? As the mayor said, we are just over 3,000 now, 3,001 deaths total, 0 identified since yesterday. And that's many deaths, as the mayor talked about. This has been very tough on the city of Philadelphia, been tough on Philadelphia individuals and on families. We hope we're nearing the end of this, but the epidemic certainly has been difficult as we mark in that milestone. Now, in the month of January, the number of deaths we're experiencing per week has been falling. We were at 92 in the first week of January, and so far on the January 31st week, we're at 37. Now, I expect more in those recent weeks, but that downward trend is clear. Now, let me talk about where we are with vaccination. Remember, we have three guiding principles with our vaccination effort. We're trying to deliver our doses we get as fast as possible and do it in the way that saves the most lives and to do it with racial equity. And we're having to work on all three. Let me first talk about our supply of vaccine. Our supply has been increasing, and there's hope that will continue to increase in the future. Now, last week, there was allocated to us for delivery this week approximately 10,700 doses of the Pfizer vaccine. That's 10,700 first doses. And the Moderna vaccine, there was an increase to 15,600 first doses, plus an additional 4,900 first doses of Moderna vaccine that were shipped directly to Rite Aid and ShopRite. These numbers are an increase. Now, I do have to note here that some of these doses that were allocated last week for delivery this week are likely to not arrive as scheduled because the bad weather has caused flight cancellations. They may arrive days later, or they may arrive even the subsequent week. But and that number is nonetheless an increase. And then this week, allocated for delivery next week, is somewhat similar, but there may be a further increase in the number of Pfizer doses. The federal government has told us that they could guarantee that we're going to get it no less than what we've been getting this week for at least the next 3 weeks. After that, though, it's unclear. Now, they have said that their best estimate is that the Johnson & Johnson vaccine may arrive approximately March 1st, although the number of doses we will get on that is unclear. And then, as the mayor said, very important, last week the White House reported that they had purchased additional doses from Pfizer and Moderna. That the country would have a total of 600 million doses by the end of July. That's really important. 600 million doses by the end of July. That's enough for nearly the entire U.S. population by the end of July. And that means to me that we should be expecting more in the future, although exactly what rate at which the number of doses arriving will increase is completely unclear at this point. With these increases, it does mean that the limiting that factor now is shifting from how many doses come into the city to how quickly we can deliver those doses. Now, we are working to increase our delivery channels to match that, and more on that in a minute. So let's talk about where we are so far with our administration of the doses that are available to us. As of midnight on Sunday, we had reports in vaccination for 151,946 people with the first dose, and then 71,949 with the second dose. Now, those numbers are an undercount. With the holidays, there's been some delay in reporting, so that data is incomplete. Those numbers should rise when we have more information. Now, there's a new metric that I want to be talking about on a weekly basis to measure how well we're doing at delivering the doses that are available to us. That'll be the total number of doses administered by week. That's either first doses or second doses combined. We'll make a distinction. Now, we count our weeks because of the way our database is set up from a Monday through the Sunday. So for that week that ended on February 7th, we delivered, or the city of Philadelphia providers combined delivered 35,668 doses. That was an all-time high at that point. But so far the next week that ended on February 14th, we know that we've delivered at least 44,000 doses, so a substantial increase. And we expect that there's going to be more because we haven't got complete reporting yet for that past week. So I'll be reporting that number of weekly doses delivered, first and second combined, on a weekly basis. And we do expect that number to increase with the number of increase in doses that we're receiving, and with more providers being enrolled, and with increased vaccination by each provider. That's what's happening citywide. Also, let me just focus for a minute on our highest risk facilities, our nursing homes and other facilities like that. Vaccination teams have now visited 89 out of 102 nursing homes, assisted living facilities, and personal care homes. So far, almost all of them. And 45 of those sites have had 2 visits, and they vaccinated 10,100 residents and 8,050 staff. So our facilities that have the most vulnerable residents now at least almost entirely had at least 1 visit. And so we do think that should reduce deaths in the future because that's where they're most likely to have occurred in the past. Now, back in the community, we are still in phase 1B, and people who are eligible for vaccination are these frontline essential workers, as we talked about before, people over the age of 75, and people with high-risk medical conditions, especially cancer, chronic kidney disease, organ transplant, and diabetes. Let me talk about how vaccine is being made available because this differs by all the different providers that have vaccine now. first with hospitals. The hospitals are now inviting their patients, typically those who are 75 or people who have those medical conditions, in for vaccination at their facilities. Each hospital is doing it somewhat differently, but to give you some sense of the numbers here, the University of Pennsylvania system has invited 28,000 people in for vaccination. Temple University's health system, 21,000. Jefferson Health System has a two-step process where people first indicate they're interested in getting vaccination and later indicate the schedule. And they started with 48,000 people. So the very large number of people who are being invited in by these hospitals. What I'm hearing is that overall about 1 in 4 or 1 in 5 people who is invited is coming in to be getting vaccinated. In addition to that process, which is an ongoing process, hospitals are running their own mass clinics in their communities. There's one last weekend run by University of Pennsylvania and Mercy, one last weekend from Jefferson, and others by Temple and Einstein that are underway. Each is doing it somewhat differently. In addition to that, we have federally qualified health centers and other clinics that serve low-income communities that are now inviting their patients in who meet these eligibility criteria. Each clinic is inviting in, on average, approximately 100 patients per week, inviting in or vaccinating, 100 patients per week. Then we have mobile teams out there visiting a variety of sites. And then we have the expanding list of pharmacies that are offering vaccination. So ShopRite has 3 locations, Walgreens, 11 locations, Rite Aid now 77 locations providing vaccine. Eligibility for these sites is people over the age of 75 from the city of Philadelphia. Now we are inviting people who are over to the age of 75 who have registered at our vaccine interest database on our website in the past. Those invitations have started going out and they will continue to go out. So we're asking people who are over the age of 75, if you haven't, you can seek vaccination at those pharmacies, or you can go to our vaccine interest database and you'll get an invitation from us. We're asking, please do not try to get vaccinated at these pharmacies if you're under 75 right now. That will be later. We want to reserve these slots for people over the age of 75. Now, in addition to those chain pharmacies, there are other pharmacies that are enrolled. Some of them have vaccine, and some of them will be getting vaccine in the next week or so. Sunray Pharmacy has 13 sites operating under different names. And Walmart and Acme, Walmart has 6 sites. Acme has 3 sites. They'll be getting vaccine next week. And then there are 4 independent pharmacies, Centennial and 4 others that either have vaccine or will be receiving vaccine next week. Then there are mass clinics. There are clinics that are run by the health department at the convention center. As the mayor said, in the last 2 weeks, the health department has run the second dose clinics to match the first doses provided by Philly Fighting COVID. And during those clinics, we vaccinated over 6,900 people, including in the last couple of days, nearly 1,000 people per day. This Friday and Saturday, we'll be running clinics back at the convention center. And we've invited to these clinics more home health aides that have yet to be vaccinated. And these people are identified through our vaccine interest database, the people who have signed up and registered there. Then, as the mayor said, there's an ongoing series of community-based vaccination sites that will begin next week. As we said last press conference, there are 3 sites that have been chosen so far: the Community Academy of Philadelphia Charter School, the MLK Older Adult Center in North Philly, and the University of Sciences in West Philly. Now, tomorrow or Thursday, we will let people know the specific dates and locations of those clinics. They're not open clinics. People can't show up there. They can't register on their own. We will be inviting people from our vaccine interest database to schedule appointments in that. Those will be people who meet our phase 1B criteria. So we'll be sending emails and phone calls to people to invite them to sign up in the next few days. In addition to that, there are clinics run by the Black Doctors COVID Consortium. They're now doing about 2,000 people per week. And then starting next week, the Children's Hospital of Philadelphia will begin to vaccinate teachers, support staff, and childcare staff. They'll start next week. They'll be putting invitations out there this week. And that includes public, private, charter schools, and parochial schools. So what should people do who want to have vaccine? Remind you again, if you believe you're eligible because of the nature of your work, you think you're a frontline essential worker, talk to your employer. If you believe you're eligible because you have some medical condition or you're over the age of 75, check with your clinic or the health system where you get your care. Or if you're over the age of 75, you can check our pharmacies, or anyone can go to our website, www.phila.gov/vaccineinterest. That's www.phila.gov/vaccineinterest, and log in their information, and then we'll notify you when you become eligible. Now, if you don't have internet and you can't register yourself, at this point now you can call 311 and people working there will sign you up for you on that database. So if you have no internet access, you could still get into our database. I also want to remind people that what we started last week was a sign-up form for organizations that have employees that they believe are eligible because they're frontline essential workers. That's www.phila.gov/businessvaccine, www.phila.gov/businessvaccine. Now, despite the name, that's for any employer of any size, not just for-profit businesses, and even for employers that don't necessarily have workers who are eligible now, but may be eligible in the future. As those organizations and those employees become eligible, we will notify them about the opportunities to get those employees vaccinated. Let me talk a little bit about the timeline here. We know that many people in Philadelphia want this vaccine, and many are frustrated that they can't get it yet. And when they know they can't get it yet, their next question is often, well, when can I get it? And we've been reluctant to answer that question because so much is unknown about how many vaccine doses we'll receive. But with the new federal announcement, for the first time, I think the numbers will enable us to give some estimates around this. But first, I have a lot of cautions here. There's still much guesswork involved. We don't know how quickly the doses of Pfizer or Moderna vaccine will arrive, even whether the previous purchases or the new purchase announced just last week. We don't know about what other vaccines are likely to be approved. We don't know how quickly we can scale up the vaccine services to match that. And we also don't know how many people amongst those eligible will choose to be vaccinated. It's entirely unclear how many people want this vaccine. We hope it's everybody. We're not sure, though. And I can say this, if that 600 million doses in the United States is available by the end of July, if that is available, and if that is given to us here in Philadelphia, our share of that, I can estimate that we will be in phase 1B until approximately the end of April, and phase 1C until approximately the end of May. And then we'll be in phase 2, and phase 2 is then everyone is eligible in June, and that we would reach everyone who wants the vaccine by the end of July. Now, that timing is in many ways positive because July is also when respiratory viruses spread, tends to hit the bottom. It tends to hit the bottom in the summer. So this all depends on the ability of Pfizer and Moderna to deliver the doses that they promised the federal government and for Philadelphia to get its share. But that gives people a rough sense of timing here. And again, don't hold me to this because there's so much unknowns here. But if that's true, what that means is that we've had a very tough winter. It'll still be tough. Things will be improving in the spring, but there's real hope for the summer. With that in mind, let me just move on now and talk briefly about where we are with our safe at home restrictions. As you know, we eased back on restrictions for restaurants. In fact, last week, we announced ventilation standards for restaurants that they could increase to 50% capacity if they had a very high level of ventilation that could be demonstrated in their dining spaces. So far, 60 restaurants have applied for that 50% capacity based on the ventilation standards. We are reviewing those. So far, 11 have been approved, 15 are still under review, and for 34, we're requesting additional information. Now, we know with this first phase of applications, many questions have been raised, and we have revised our application form to make it clearer on what information needs to be provided and how people can get that information. We've also produced a video to show people exactly how to measure their restaurant and how to calculate the numbers that are in that form. That video will be posted very soon. Now, these measurements can be done by an HVAC technician. If people don't feel like they have the expertise to measure, then they don't need to do that. But if the restaurants feel that they can do it, they can do those measurements themselves. It's at their option. Now, that's what's happening in restaurants. In light of the falling cases, we will consider easing other restrictions. I have nothing to announce today, but we will announce those other restrictions, any changes in other restrictions as soon as we are ready with those. So what should people do now? Just remind people, please keep up the masks and distances. Even if you're vaccinated, there's still plenty of infection out there. Keep up the mask and distance. And no indoor gatherings of any sort. If you do get together with others, do it outside wearing masks. More information on all this is on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. We're going to hand things over to Armando now to provide a summary of the remarks in Spanish.
Palabras del alcalde Jim Kenney para el día 16 de febrero del 2021. Buenas tardes. Tengo que empezar hoy con una triste noticia. Ayer registramos la muerte número 3.019 en Filadelfia. Más de 3.000 habitantes de Filadelfia perdieron la vida a causa de este terrible virus en menos de un año. Pienso en los seres queridos de aquellos que hemos perdido y estoy rezando por ellos. Con esto en mente, con gran pena les informo que otro miembro de la familia de la ciudad de Filadelfia sucumbió a este virus. El bombero John Evans falleció el sábado después de una dura lucha contra el COVID-19. John trabajó en el Departamento de Bomberos de Filadelfia durante casi 4 décadas. Enviamos nuestras condolencias a su familia, al comisionado Thiel y a todos en el Departamento de Bomberos. Y a pesar del sombrío hito que marcamos esta semana y de los desafíos experimentados recientemente, quiero tomarme un momento para reconocer también que en Filadelfia las cosas se están moviendo en la dirección correcta en cuanto se trata de combatir el COVID-19 y vacunar a las personas. Nuestros nuevos recuentos de casos continúan disminuyendo y las tasas de positividad semanales son más bajas que en los condados vecinos. Se han administrado ya más de 200,000 dosis de la vacuna, con más de 72,000 personas completamente vacunadas. Todavía nos queda un largo camino por recorrer antes de que estemos todos del otro lado de esto, pero tenemos motivos para tener esperanza. La semana pasada, la administración Biden anunció que había comprado otras 200 millones de dosis de vacunas. Estamos comenzando a ver un aumento de nuestras asignaciones semanales. Esperamos que la vacuna de Johnson & Johnson esté disponible muy pronto. El pasado fin de semana, el Departamento de Salud finalizó las clínicas para administrar la segunda dosis a las personas que habían recibido una primera dosis de la vacuna a través de Philly Fighting COVID. Los aliados en la distribución de vacunas están trabajando para llegar a más miembros de la comunidad en sus vecindarios, especialmente en las comunidades de color. La próxima semana, el Departamento de Salud abrirá clínicas de vacunación masiva ubicadas en el corazón de nuestras comunidades más necesitadas. Hoy, más que nunca, podemos afirmar que Filadelfia avanza y que va en la dirección correcta. Al mismo tiempo, estamos pensando en el futuro de nuestra ciudad. Nuestra economía y la cultura de Filadelfia dependen de las personas. La gente va a los lugares de trabajo, se sienta a comer en restaurantes, hace compras, asiste a reuniones y no solo sube corriendo los escalones del Museo de Arte, sino que también busca explorar su interior. Pensamos en el futuro y planificamos desde ya para estar listos el día en que la mayoría de los habitantes de Filadelfia estén ya vacunados. Ese día en el futuro no muy lejano en el que los residentes y los visitantes puedan comenzar a disfrutar de manera segura y gradual todo lo que amamos de Filadelfia. Pero trabajar con nuestros aliados en medida que nos acerquemos a ese día tan esperado para asegurar que Filadelfia esté lista para regresar más fuerte que nunca. Hasta entonces, nos mantenemos enfocados en mitigar la propagación del COVID-19 en la comunidad y en vacunar a los residentes lo más pronto posible. Y esta es la actualización en materia de salud para el día 16 de febrero del año 2021. El número de casos está disminuyendo. Hoy proporcionaremos actualizaciones sobre la epidemia e información actualizada sobre la disponibilidad de las vacunas. Y comenzamos con los números del día de hoy. Hoy confirmamos 103 casos nuevos por prueba PCR, con un total de 110,836 casos confirmados. La semana pasada, del 7 al 13 de febrero, el promedio de casos diarios hasta entonces había sido de 242 casos por día, basados ambos en las pruebas PCR y la de antígenos, con un 3,8% de pruebas positivas. Y la semana previa, el día 31 de enero al día 6 de febrero, el promedio había sido de 323 casos por día, con un 5,3% de pruebas positivas. Los casos ahora siguen disminuyendo en Pensilvania, en Nueva Jersey y en los Estados Unidos en general, y es bueno ver esta tendencia a la baja. Con relación a las muertes, felizmente el día de hoy no identificamos ningún fallecimiento, y el total acumulado de muertes es 3,001 muertes por el COVID-19 en nuestra ciudad. En enero registramos una caída de 92 muertes durante la primera semana a 37 muertes semanales durante la semana del 31 de enero. En cuanto a la vacunación, estamos basando nuestro trabajo en 3 principios rectores: la rapidez, el cómo podemos salvar la mayoría de vidas y el encontrar equidad racial. En relación al suministro de vacunas, el suministro que recibimos se ha incrementado. Se asignaron la semana pasada para entrega esta semana 10,700 dosis de Pfizer, 15,600 dosis de la vacuna de Moderna, más 4,900 dosis adicionales para ser distribuidas en ShopRite y en Rite Aid. Estas vacunas podrían retrasarse, sin embargo, debido al clima y las condiciones climáticas. Esperamos un incremento en las dosis de vacuna de Pfizer para la próxima semana. Asimismo, esperamos que la vacuna de Johnson & Johnson llegue a Filadelfia aproximadamente la semana del 1 de marzo. La Casa Blanca reportó que 600 millones de dosis serían distribuidas a finales de julio, lo suficiente para vacunar a la población de todos los Estados Unidos. Ahora, el factor limitante es cuán rápido estas vacunas pueden ser entregadas a las municipalidades. ¿Cómo se está administrando la vacuna? Hasta el domingo por la tarde se informó que 151.946 personas habían recibido la primera dosis y 71.949 personas la segunda dosis. Estos datos pueden cambiar por el feriado, ya que hay retrasos en el procesamiento de los datos. La semana pasada, que terminó el 7 de febrero, culminó con 35.668 dosis administradas. Y hasta el momento, aproximadamente 44.000 dosis han sido entregadas la semana pasada. Los datos que hemos recibido por el momento son incompletos. Así que estaremos haciendo reportes semanales. Esperamos también aumentar el número de proveedores inscritos para aumentar la vacunación en cada uno. Los equipos del Departamento de Salud han visitado 89 de 102 hogares para ancianos y centros de salud a largo plazo, y 45 sitios han recibido ya 2 visitas de nuestros equipos. Se han vacunado a 10.100 residentes y a 8.050 trabajadores. Y nosotros continuamos con la fase 1B, que aún durará muchas semanas. Esta fase incluye a la gente que estamos vacunando en momentos actuales, que incluye a trabajadores esenciales de primera línea, tales como socorristas, trabajadores penitenciarios e internos, proveedores de servicios que trabajan con poblaciones vulnerables y pronto a las personas que trabajan en el transporte público. Las personas que trabajan en entornos de personas congregadas, como instalaciones de salud conductual, a las personas mayores de 75 años de edad, a las personas con condiciones médicas de alto riesgo, especialmente aquellos que padecen de cáncer, de enfermedad renal crónica, de trasplante de órganos y de diabetes. ¿Cómo se está administrando la vacuna? Primero, en los hospitales, que invitan a sus pacientes mayores de 75 años de edad o a los que presentan condiciones de salud preexistentes a recibir la vacuna en Penn, en Temple, en Jefferson. En las clínicas de vacunación comunitaria que se están dando en Penn y Mercy, en Jefferson, en Temple y en el Centro Médico Einstein. A través de los centros de salud federalmente calificados que vacunan aproximadamente a 100 personas por clínica cada semana. En las clínicas móviles. Y a través de las farmacias, ShopRite, que tiene 3 ubicaciones, y Walgreens, que tiene 11 ubicaciones. Rite Aid también tiene 77 ubicaciones. La elegibilidad es ser mayor de 75 años de edad, así que por favor, no se registre si no es mayor de 75 años. Hay otras farmacias que también hemos incluido. Sunray con 13 ubicaciones, Walmart con 6 ubicaciones y Acme con 3 ubicaciones para la próxima semana. Hay también farmacias independientes como Centennial y anunciaremos muchas más la próxima semana. En cuanto a las clínicas masivas, están dirigidas por el Departamento de Salud en el centro de convenciones. Estamos allí administrando las segundas dosis a quienes se vacunaron a través del grupo Philly Fighting COVID. Se han administrado un total de 6.911 segundas dosis en total. Hemos elegido 3 sitios que funcionan como clínicas comunitarias masivas. El Community Academy of Philadelphia Charter School, en la parte noreste de Filadelfia, en el 1100 este de la avenida Erie. El Centro de Adultos Mayores de Martin Luther King, en el norte de Filadelfia, ubicado en el 2100 de la avenida Cecil B. DeMore. En la Universidad de las Ciencias, en el oeste de Filadelfia, ubicada en el 730 sur de la calle 43. Invitamos a las personas que cumplan con los criterios de la fase 1B a que se registren en el portal de la ciudad. Estaremos enviando correos electrónicos y llamando a las personas cuando haya citas disponibles. Y también lo estamos haciendo a través del Black Doctors COVID Consortium, que aproximadamente vacunó a 2.000 personas por semana. El Hospital de Niños de Filadelfia nos apoyará para vacunar a los maestros, al personal de apoyo y al personal de cuidado infantil a partir de la próxima semana. Si usted quiere recibir las vacunas, este es el procedimiento que debe observar. Si es elegible por su trabajo, debe hablar con su empleador para que llene el formulario de planificación para empleadores. Si tiene una condición médica o es mayor de 75 años de edad, por favor consulte a su hospital o al sistema de salud de la ciudad. Si tiene más de 75 años, también puede obtener las vacunas a través de la red de farmacias. Si no está seguro, puede registrar su interés en vacunarse en phila.gov/diagonal Vaccine Interest. Si usted no tiene internet, puede hacerlo llamando al número 311. Si usted es joven y saludable, tendrá que esperar. Si usted es un empleador de trabajadores esenciales, debe registrarse como empleo en fila.gov/business vaccine. Esto se aplica para cualquier empleador de cualquier tamaño y no solamente para las empresas con fines de lucro. Acerca de los tiempos para la vacunación. Hay muchas personas frustradas porque todavía no pueden obtener la vacuna. Hay muchos que se preguntan cuándo podrán vacunarse. Con un nuevo anuncio federal, tenemos números que por primera vez nos permiten comenzar a dar estimados. Todavía hay muchas preguntas. Por ejemplo, ¿con qué rapidez llegarán las dosis de Pfizer y de Moderna? ¿Cuándo se aprobarán las nuevas vacunas? ¿Cuándo se podrán ampliar los servicios de vacunación? ¿Y cuántas personas elegirán voluntariamente vacunarse? Si hay 600 millones de dosis que se distribuyen en los Estados Unidos para finales de julio, estimamos que la fase 1B durará hasta finales de abril y que la fase 1C hasta finales de mayo. Luego comenzaría la fase 2, abierta para todos en junio. De esta manera, se tienen suministros de vacunación disponibles para todos los que quieran vacunarse a finales de julio, cuando la propagación del virus respiratorio tiende a tocar fondo de cualquier manera. Dependemos de Pfizer y Moderna para ofrecer más vacunas. Entonces, podemos ver que vamos a tener un invierno muy duro, vamos a mejorar en la primavera y veremos reales esperanzas para el verano. ¿Cuáles son las restricciones del plan Más Seguro en Casa? Como recordatorio, les informamos que hemos anunciado algunas medidas para los restaurantes enfocadas en mejorar los estándares de ventilación vigentes para que los restaurantes puedan aumentar al 50% la capacidad de asientos que sirven en sus interiores. Hasta ahora hay 60 restaurantes que solicitaron. 11 han sido aprobados, 15 están en revisión y 34 están solicitando más información. Hemos recibido muchas preguntas. Hemos revisado el formulario de solicitud para que les quede más claro. Asimismo, hemos producido un video para mostrar cómo medir y cómo calcular mejor la información que solicitamos. Y esto se publicará muy pronto. Esta medición puede ser realizada por un técnico de aire acondicionado y calefacción o por el mismo personal del restaurante. Debido a la caída de los casos, consideraremos también aliviar otras restricciones que teníamos. No tenemos nada que anunciar en este respecto el día de hoy y esto se hará cuando estemos listos. ¿Qué debería hacer la gente ahora? Mantener el uso de las máscaras y el distanciamiento social, incluso si ya está vacunado. Recordar que no se permiten reuniones en interiores por ningún motivo. Y recordarles finalmente que si se reúne con otras personas, lo haga al aire libre, usando mascarillas. Y finalmente, recordarles que solamente juntos podremos y superaremos esta gran prueba. Muchas gracias.
Thank you, Armando. We're now going to move to Q&A for members of the press. In addition to Mayor Kenny and Dr. Farley, we're also joined by Managing Director Tumar Alexander. Because of limited time, only one representative from each media outlet will be permitted to ask questions. And due to the higher volume of folks who have questions today, we are also going to ask that each outlet limit their questions to just 2 or fewer. If we have time to come back for additional questions, we will. In addition, because of the limited time and the high number of questions today, we won't be taking any questions on non-COVID topics. So if you do have questions regarding something other than COVID-19, please send those to press@phila.gov. Today, we will kick things off with Mitch Blocker from NBC 10. Mitch, you should be able to unmute and ask your questions.
Thank you, and good afternoon, everybody. Dr. Farley, you talk about distribution channels, and I know you've discussed this before, but I'd like your thoughts again. Other cities are using their stadiums as vaccination hubs. Why isn't Philadelphia?
You're muted, Doc.
Sorry about that. I think there is a value to adding to the current distribution channels very large, high throughput mass vaccination clinics. I don't think the right place to put that in Philadelphia right now is a stadium, both because of the weather right now and because the stadiums we have are at one extreme part of the city that reaches more people in the suburbs than necessarily in the city. We want people within the city to be vaccinated. But I do think that as we get more doses in, we need to increase the number of vaccinated. Adding larger high throughput sites makes sense.
You know, it's important to understand that we're not eliminating Lincoln Financial Field for some ultimate use in that regard. It's just not going to be the first one out of the box for various reasons.
And when do you believe that vaccine supply will catch up with the demand? And has the health department done anything specifically to consistently get more shots out of vials?
So all the providers are, since the beginning, in the first day or two, when we identified that you could get more shots out of the Pfizer vial, all the providers have been asked to do that, and you have to use a certain needle to do that. Now, the way that the Pfizer doses are counted, it's assuming that you can get that many doses out of that vial. So even though the same vials, the numbers we're recording are higher than that. You can't get additional doses out of the Moderna vials, I don't believe, although there is talk that Moderna will be able to put more doses in those vials, and that could bring about a substantial increase in the number of Moderna doses we receive. I don't know when that's going to happen, but that would certainly be welcome.
And supply reaching or meeting demand? You talked about only about a quarter or 20% of hospital appointments showing up, but you certainly have more people in the queue than you have demand, right? When do you think the supply meets it?
We don't know how many people in the city really want to have vaccine now. National surveys show it's about 2/3. And so if we have 1.2 million adults, there's maybe 800,000 adults out there who really want to be vaccinated. And we vaccinated 150,000 so far. So the demand is way beyond that. So I gave you the timeline, my best guess a minute ago, as to when we get to phase 2. But it's going to be some time, but it's not forever now. It's within a number of weeks we can start to see. And our ability to meet that demand depends on two factors. It's the number of doses that come into the city, and then also our ability to have the clinical services to meet that demand. Up until now, our limit really has been the number of doses, but it's shifting now to, as the doses increase, to be more on the vaccine administration side, but we're increasing that as well. So we're going to both, I hope, will increase in parallel, and then until we meet that demand of 2/3, or I hope ultimately it's 90% want to be vaccinated.
Thank you.
Thank you, Dr. Farley, and thank you, Mitch. Next up, we have Jeff Cole from Fox 29. Jeff, you should be able to unmute and ask your questions.
Yeah, here we go. Questions, at least to start for the mayor. Mayor, COVID in schools, the 22nd on Monday, Dr. Haidt wants students back into the classroom. Are Philadelphia students, 9,000 of them, going to go back to the classroom on Monday, in your view?
Well, first of all, we're working with the district and the union in an effort to work with the mediator to make determinations on the safety of schools and which the union thinks is not safe, which the district thinks are the things that are in the MOU we need to work out through the mediator. So, and we're also, as you know, going to start vaccinating both the staff, frontline staff, teachers, principals, people who work in the buildings, and that'll start on Monday. And I think as we move towards more and more people vaccinated, discussions and resolutions on the buildings themselves, I think we'll get where we need to be.
So it's Tuesday. That sounds like a lot of work. Is Monday even realistic then, Mayor, considering the mediator is still talking to folks?
Well, this entire effort's been a lot of work. I mean, since last March, where again, we can't physically force teachers back into schools. We want everybody to go back with the right attitude and the right positive attitude and feel safe about the location that they're in, including the teachers and the students. So we're working our best every day. Our Deputy Mayor for Labor, Rich Laser, is meeting with folks all the time, and we're moving towards getting that resolution. This is not an exact science. It's more of an art, and trying to get people to feel that they're safe and that parents want to send their kids to school.
I'm sorry. So what do we tell parents about Monday?
I'd have to get back to you on exactly what that message will be. I'm sure there'll be something later in the week.
Thank you.
Thanks, Jeff. Next up, we have Tim Check from Philadelphia Gay News. Tim, you should be able to unmute.
Yes, this is a question for Dr. Farley. Someone with AIDS has complained to me they were turned away from getting the vaccine. Could you explain the situation with people with AIDS and why that's not considered a health condition right now in this phase of the vaccine?
So my understanding is, and I'll need to double check, that people who have immune deficiency due to HIV infection, so full-blown AIDS, are eligible under as high-risk criteria defined by the CDC. but people who have HIV infection and have a normal immune system because they're under treatment, and most people with HIV infection are, they would not be now. Now, I would say being eligible in phase 1B doesn't mean you're going to get a dose right now, because that there are many, many people, hundreds of thousands of people in phase 1B. So I don't know the particulars of that individual person, but even if they're eligible, it may be that they might have had difficulty getting vaccine like many others.
Thank you.
Thank you, Tim. Next up, we have Maggie Kent with 6ABC. Maggie, you should be able to unmute.
Hi, everyone. So again, I wanted to touch base, and I know this is, I don't know if you're going to love it or not, but I just was in the fiscal meeting, and it is kind of coronavirus related. I understand that we're in a huge deficit right now. So what are some of the things that we're doing when it comes to coronavirus and getting back on track to help the city out when it comes to next year's financial situation?
Well, I'll let Marissa and Rob jump in on the technical side of it, but right now we're still waiting to see what the COVID relief package is going to be like. Certainly what has been promoted by or announced by the president is something that's intriguing and good for cities and states. The devil lies in the details as to whether or not there's going to be enough direct aid to cities and states, whether or not that aid is going to be funneled through the states to the cities or to the cities direct, how much it's going to be. So these are all unknown factors, although I think the framework is there for us to be safe. But in the short term, we have to plan that if it goes sideways and off the rails, we still have the fiscal problem that we're facing. We're hoping that the feds will be able to come somewhat to the rescue, but we have to prepare in the interim. Marissa?
Yeah, thank you, Mayor. And just to give you a bit more of the specifics, this morning we released information around a potential $450 million deficit in the upcoming FY22 budget for the city's general fund. And as the mayor mentioned, we're optimistic about federal funding being able to come in, but we still don't know about the timing, about the formula that winds up being passed, about how much will be allocated. Will it come directly to the city or will it flow through states? And that adds a lot of uncertainty. But the second part of the challenge there is also that $450 million gap is just this year, but because of the pandemic, we now have structural issues that are going to carry on for many years, whereas we think any federal relief will be one time. So even if the number for the federal relief is bigger than that $450 million gap, we're probably going to need to spend that relief out over several years, stretch it out so that we can, not just get through a balanced budget this year, but across our 5-year plan.
And that's why we delay the submission of the budget, so we have a better idea of where we stand. And then we'll enter the budget process, and that's a process of onto itself. Our council will express their priorities for the year. We'll have hard choices probably to make, and we'll have to hash it out between council, their constituents, and administration.
Thank you.
Great, thanks, Maggie. Next, we have Pat with KYW. Pat, you can go ahead and unmute. Pat, you're unmuted, but we're not hearing you. I don't know if you want to try to.
Sorry, I'm sorry.
No problem.
I just wanted to clarify the numbers that Dr. Farley gave about the hospitals. When you say Penn contacted 28,000 and 1 out of 4 or 5 are interested, that means they vaccinated 7,000? Or they called 100,000?
No, these are approximate numbers. They were not firm numbers, but this is what I got from conversations with their chief medical officers. So this is how many they sent out invitations to that many people. And then that 1 in 4, 1 in 5 is how many scheduled an appointment in the few days after they got that invitation. So I don't know how long it'll be for them to get that appointment done and to be vaccinated.
Okay, and then I also had a question about signing up with pharmacies directly. I think last time you said that pharmacies were using your registration list. Are they still, or can you sign up directly with?
Each pharmacy is somewhat different, and we are some of them may have actually posted on public sites their sign up, other ones that may be private, and we're directing them to them. And I don't have all that information, but we're trying to have it be so that it's not so public that that they are their sites crash with people who are ineligible trying to sign up. So we're trying to direct the people who are the most important, which are age 75 plus, to them.
Okay, and if somebody signs up in multiple places and then they get a shot, is there a way to remove themselves from the registration list, or does it not matter?
So we will be reconciling our vaccine interest database with our vaccine database and see who has been vaccinated and then taking it from them. And then we haven't done that yet. So it may be that people will be receiving invitations who've already been vaccinated. Obviously, if you receive an invitation from us and you've already been vaccinated, then we ask you not to schedule an appointment.
Okay, thank you.
Thanks, Pat. Next up, we have Argenis Figueroa from Univision. And just a note to everyone, we have about 15 minutes left and quite a few people to still get through. So as a courtesy to your colleagues, if we can keep the questions tight so we can get everyone's answered. Argenis, you can go ahead and unmute to ask your questions.
Okay, thank you so much. Good afternoon. We have two questions. The first one for the mayor. Armando, ¿me puedes ayudar con la traducción, por favor?
Con gusto, Argenis.
Gracias. Armando, la pregunta es para el alcalde sobre si podría verse afectada su respuesta a la lucha contra el COVID-19 basado en el déficit presupuestario que ya visionan para el 2022. Y yo sé que quizás no es relativo al tema, pero si puede decirle a la comunidad hispana por qué es importante participar en la consulta que están haciendo sobre el presupuesto.
¿Te refieres tú a la encuesta, a la
Sí,
consulta que ha hecho la ciudad?
Encuesta, sí.
Bien, gracias.
Para las prioridades.
Cómo no, gracias. The question is for the mayor. Mayor, do you think that the city's response to COVID-19 will be affected by the projected budget deficit in 2022? And number two is, what could you tell the Hispanic community about the importance of participating in the survey that the city's put out in terms of the budget for 2022?
Well, first of all, the second one, I think it's very important that they participate in the survey. We want to hear from all segments of our communities, especially our Spanish community, and make sure that they have their issues that they're important to them, highlight them so we know when we're going through our budget process that their wishes or their thoughts are taken into consideration. And what was the first one was?
If you could estimate if there's going to be some sort of an impediment to the city's response to COVID-19 in light of the budget deficit for 2022.
I don't anticipate that. I mean, I don't see how it would directly impact it. I think what we're doing with the federal government and with the state government, with our vaccination sites, getting the doses in people's arms, we'll see what happens as we go in to the budget process, but it's not anticipated. But if it is, we'll address it.
Thank you, Mayor. Argenis, la respuesta a la pregunta con relación a la participación de la comunidad hispana en el sondeo con respecto a la confección del presupuesto para el año 2022. Obviamente nosotros queremos que todos los ciudadanos de Filadelfia participen en la confección de este segmento. Necesitamos que todos los segmentos de la ciudad estén representados, especialmente la comunidad hispana. Queremos saber cuáles son los temas y problemas que quieren que se subrayen, de manera que sepamos cuáles son sus ideas y sus inquietudes. Con respecto a la segunda pregunta sobre si el impacto de una crisis o de un déficit presupuestario del año 2022 impactara en la respuesta de la ciudad contra la lucha del COVID-19, la ciudad no anticipa que haya un efecto directo y se está trabajando con el gobierno federal y el gobierno estatal. Se están poniendo los lugares disponibles para que se den las inyecciones y las dosis de la vacuna lleguen a los brazos de los ciudadanos. Y si hubiera algún problema relacionado con el presupuesto en este esfuerzo, obviamente nosotros nos pondríamos al nivel de las circunstancias y lo resolveríamos. Muchas gracias.
La segunda pregunta es para el Dr. Farley. Para saber cómo y cuándo planean abordar la vacunación de los desamparados.
The second question is for Dr. Farley, and the question is, how and when do you plan to approach vaccination for the city's homeless population?
we are working with homeless shelters right now on getting vaccination of staff and residents. I don't know the details beyond that, but that's happening soon. As far as people who are on the street, that's going to be tougher. We'll get to them later.
Nosotros actualmente estamos trabajando con los refugios para tratar de inocular a su personal y a los residentes, y no tengo mayores detalles al respecto. Y más adelante, para trabajar con la gente que no está en los refugios y que está por las calles, lo tendremos que ver más adelante y resolverlo. Gracias.
Vale, muchas gracias a ustedes. Thank you.
Thanks to you all.
Thank you, Argenis. Next up, we have Isabella Sanchez from Telemundo. Isabel, you can go ahead and unmute.
Thank you so much, Armando. Mi pregunta es para el doctor Farley. Hemos recibido muchísimas llamadas de televidentes de la tercera edad con muchas condiciones preexistentes que dicen que registrarse ha sido una pesadilla. No tienen correo electrónico, no tienen acceso a computadoras e incluso por teléfono se les ha hecho muy difícil. ¿Qué tipo de ayuda o soporte se les está brindando a comunidades en las que la barrera de la tecnología y la barrera del idioma son un reto, ya que hay mucha gente que califica en la comunidad hispana y no ha podido vacunarse?
Dr. Farley, the question is for you. We've received calls from a lot of TV viewers about senior citizens who are having a nightmare of a time trying to get registered for inoculation with the vaccine, be it because of issues with a computer or even through the telephone. What sort of support is there available for them in terms of technology and language access for those people who are eligible and are having such a hard time getting registered to get the vaccine?
First, let me be clear that there's many people, regardless of what language they speak, are having difficulty getting the vaccine now. There's just a limited number of slots and many, many people who are eligible by being in phase 1B. But people who want to be in our database don't have to sign up themselves. They can now call 311, and we have people who speak Spanish there who can get them registered in the database. And if there are any community organizations that are helping people, they can register folks for them. Anybody can go in the database, and you can register someone else, and then we will reach out to them in Spanish.
Thank you, Dr. Farley. Isabel, primero quiero que quede claro que hay muchas personas que están experimentando dificultades para poder acceder al programa de vacunación, sencillamente porque hay recursos limitados en cuanto a las dosis de vacunas disponibles durante la fase 1B en la cual estamos todavía. Sin embargo, esta base de datos que nos permite registrar a las personas que van a ser vacunadas eventualmente se puede rellenar a nombre de otras personas. Es decir, las personas que están teniendo dificultad pueden llamar al número 311 y ahí encontrarán apoyo en español que les va a permitir registrarse para este esfuerzo. También hay organizaciones comunitarias que están tratando de hacer esto y que pueden registrar a la gente en sus comunidades a nombre de ellas cuando tienen dificultades. Y obviamente esto es algo que nosotros, al tener esa información y al haber las citas disponibles, les comunicaremos su disposición o sus citas en español.
Gracias, Armando. Quick follow-up. ¿Alguna organización con la que la ciudad esté trabajando de manera específica que atienda a la comunidad hispana?
A quick follow-up question, Dr. Farley. Is there any specific community organization that you're working with the Hispanic community?
There's a number of organizations that we had conversations with, including like coalitions of organizations that we've talked to. No one single organization.
Nosotros hemos estado teniendo conversaciones con muchas organizaciones comunitarias y con coaliciones de diferentes organizaciones comunitarias, ninguna en particular.
Thank you so much.
Thank you.
Thank you, Isabel. Next up, we have Jack Tomsick at the Metro. Jack, you can unmute.
Right, thank you. This is for Dr. Farley. Does the city plan to use the convention center as a mass vaccination site beyond the Philly Fighting COVID patients and the home healthcare aides? And if so, do you know how many people you could do a day there?
I would say the convention center is an excellent site for vaccination. And so I imagine we will use it in the future, but exactly for whom, I don't know. We don't have specific plans for that yet. I do think there definitely is potential for a lot more. It's a huge space, very well suited for this sort of thing.
And another question I had is how many people, do you have any data on how many people have been able to set up an appointment through the vaccine interest form?
We don't. I can say that we just started inviting people from that vaccine interest database in the past few days, but that we are sending out thousands of notices to people on that just last week and this week. For starters, we should, by the end of this week, everyone in that database over the age of 75 should be given a notice about where they can go to register for an appointment. I'm not sure if they can all get appointments, but I'm hoping a good fraction of them will. There are many people on the database. It'll take us a while to get through all of them, but it definitely is. We have started the process of getting those invitations out and making that a worthwhile database.
All right, thank you.
Thanks, Jack. Next up, we have Kennedy Rose at Philadelphia Business Journal. Kennedy, you can unmute.
All right. Hi, everybody. Thank you so much for taking the time. My first question is for Mayor Kenney. I was wondering, what is the status of yours or even any city officials' interactions with the group behind Operation Philly Special, the group behind wanting the mass vaccination site at Lincoln Financial Field? Have you had any conversations with them? Are you even entertaining speaking with them about this at all?
I did not have specific conversation with them myself. Don't know if staff has. I could find out and get back to you. It's not that this location has been eliminated. It's just not the first one out of the box for various reasons, and it will continue to be considered as a place for mass vaccinations as the vaccination amounts ramp up and the weather gets better.
Okay, and my next question is for Dr. Farley. I was wondering, how many doses of the vaccine would you estimate the city would need to be receiving weekly for a site like Lincoln Financial Field to get the green light from the city?
Again, it's not, the question assumes that the only place that we can have a large number of people come through is Lincoln Financial Field, and there are other options for that. And so the reason we're not interested in Lincoln Financial Field right now has to do with the weather and the location of it. But that doesn't mean that there are other places we could do high volume vaccination that don't have those problems.
Okay, thanks so much. Have a good one.
Thank you, Kennedy. Next up, we have Trang Do from CBS 3. Trang, you can go ahead and unmute.
Hi, thanks so much for taking my question. I have two questions, actually. The first, I think Mayor Kenney or perhaps Dr. Farley could potentially answer this. We're just wanting to get some more details about the state of discussions with FEMA to deliver vaccine to the city and when that might start.
Doctor?
I'm just saying we are in discussions with the federal government about large volume vaccination sites. Nothing to announce final yet, but those discussions there's about the question of the sites and also a question whether sites come with additional vaccine or whether the sites would use the vaccine we currently have. Neither of those have been pinned down yet.
Thank you. And my second question has to do with the restaurant ventilation standards.
Yeah.
We spoke to a building engineer who held a seminar for a number of restaurant tours yesterday, and it was his professional opinion that they're a little bit cost prohibitive, and he would love to speak with you, Dr. Farley. I don't know if you received his letter, if you do plan to speak with him, and perhaps if there are any considerations to maybe lessen these restrictions or modify them to make them more attainable while still allowing restaurants to operate safely.
So, we, in developing those standards, we talked to a large number of restaurants, and we also talked to industrial hygienists who are experts in this. And we also went out and measured 4 restaurants in the city of Philadelphia. All 4 of the restaurants that we measured far exceeded those standards. So I've heard this before that somehow these were impossible to meet. And again, we were 4 for 4. They far exceeded those standards. So I do think it's possible. We also, with the experts that we spoke to, came up with a variety of options for how restaurants can meet the standards that were not terribly expensive. So we're always interested in input. But again, our early take on this is these are things which are doable. We want the standards to be high. We want the ventilation to be high, so that people are safe. We do feel that it's pretty comfortable. We do feel comfortable. It's pretty safe for people to be eating outdoors. And so we say, what kind of ventilation do we need to have it be as safe indoors as it is outdoors? That's a very high level of ventilation. And I think people eating at restaurants would appreciate the fact that they're meeting a very high level of ventilation to make it safe for them.
Thank you very much. Appreciate it.
Thank you, Trang. Next up, we have Johan Calhoun with Chalkbeat. Johan, you can go ahead and unmute.
Thank you. 2 quick questions for Dr. Farley and the mayor. Can you give us an update on the mediator in Chicago, and do you expect an answer before Monday?
don't know about the mediator in Chicago. I hope to get an answer before Monday. But the mediator, I mean, again, people are working very hard on this, are working long hours, worked yesterday during the holiday. And there's a lot of information that needs to be sorted through. And we're hoping for an answer as soon as possible. And we're hoping we'll get one before Monday. I don't understand. I don't know the Chicago issue.
Mayor, he's just referring to the mediator being based in Chicago. The one.
Oh, I'm sorry.
It's okay.
Yeah, he's based in Chicago.
I thought you were talking about Chicago School District.
All right.
No, I'm not sure exactly when. Hoping as soon as possible.
Okay, now if teachers don't show up to school Monday, will they be disciplined? Because Dr. Haidt did mention that last time. And will you ultimately make the call again when teachers go back, if they can go back or not?
I don't want to see anybody disciplined. I want to get kids back in the classroom. I want teachers to go back in the classroom. There are schools that have been operating now in both the parochial system and in the charter system that have been operating. We think that our hybrid model is safe. But again, I don't want to do this in a punitive way. We've all been through a lot in the last year, and everybody's scared, everybody's stressed, and adding more stress to that by quote unquote disciplining people, I don't think gets us anywhere, and maybe forebodes a longer term problem with management staff personnel.
Are school prepared to reopen February 22nd? Should they wait another week or two?
We're going to have to see when we get there. This is not, I mean, I know reporters like to anticipate and predict. This is not a predictable situation all the time, especially with this COVID, with this virus. So we're hoping the mediator comes up with the plan, comes up with ruling. We hope that we can get teachers vaccinated, get kids back in school, and get back to a normal classroom. But I couldn't tell you for sure it's going to be on Monday.
Good deal. Thank you.
Thanks, Johan. Next up, we have Martin Pratt with Philly Your Black News. Martin, go ahead and unmute.
Yes, this question is for Dr. Farley. Dr. Farley, can you explain a little bit more about the process of ventilation? When I've talked to some restaurateurs, they were saying that their concern is that we're just shoving the air particles along. We're not really doing anything to kill them. Like some have mentioned buying these, which I talked about last week, photocatalytic catalyst oxygenators that the NASA is using that actually kill the particles.
Yeah, there are three elements to the standards. There's the number of air changes per hour, that's how quickly the air is moving. Then there's the percent of outdoor air that is mixed in as it moves. And then there's the filtration. And so if you're moving the air a lot, then that means the air is very frequently going through those filters. And the filters then filter out the droplets. So we don't think it's necessary to add on top of that some of these, which could be fairly expensive systems that add UV light or whatever. You can simply filter out those droplets. And so we think this is achievable at a reasonable cost, as well as being safe.
All right, thanks, Martin. Next up, we have Matt Rothstein from BizNow, and Matt will be the final set of questions for the day. So Matt, go ahead and unmute.
Hi, thank you. I just have one question actually for Dr. Farley. So aside from the vaccines that are being distributed directly by the city through the convention center and the public clinics, what criteria does the department use in determining how much vaccine each separate provider gets? Is it based on capacity to distribute the vaccine? And if so, how is that capacity determined?
So for each provider, yes, it is dependent, not entirely, but in large part on how many doses we think that they can deliver. And that's based on how many they have delivered in past weeks and how many they believe that they may deliver in the future if they are just new and are just scaling up. And so we do have data on how many doses each provider is delivering each week to base that information on.
Yes, and so the determination of capacity is taken on faith from these providers?
No, as I said, we have data on how many they've delivered in past weeks. And then you do factor in how many they say they can deliver the next week. And if we give them vaccine and they can't deliver it, then that would be taken into account in subsequent allocations.
Okay, so would it be reasonable then to assume that each provider, if it shows it's capable, can get more vaccine in subsequent rounds?
Yes.
Okay. Thanks very much.
And I should say, we also factor into this racial equity. The different providers reach different populations. And so, for example, that's, we want to make sure that the federally qualified health centers are well stocked because they're reaching low income minority populations, immigrant populations that might otherwise be missed.
Oh, sorry. And the last part of that is when, evaluating their claims on how much vaccine they can distribute, is the amount of physical space or what building they're based in part of that consideration at all?
Only in their own minds. They can say how many they can do based on their staffing, and the building's space is rarely the limiting factor. It's more their staffing.
Okay, thank you very much.
Okay, thank you, everybody. That concludes today's daily press briefing. And if you have any other remaining questions, please send those to press@phila.gov. Thank you.